Your hormones affect how your tissues move and how they remodel and how you feel. We should have known that, ladies, when our friends that had to go on aromatase inhibitors, which sucks out every ounce of estrogen out of your body to starve cancer. The women that are on this know that the joint pain, the fatigue, the muscle pain is widespread because when you take estrogen out of the equation, all those estrogen receptors in all those tissues are starving and they feel horrible and they feel stiff and there's no pliability because we have estrogen receptors everywhere. Now, it's not surprising to you that we have estrogen receptors in our bone because you know when you become postmenopausal, you have a high risk of osteoporosis. And you know this because you've been told it, right? But what if I told you you have estrogen receptors all throughout your body, and I, as a physical therapist, like to talk to you about the receptors in your bones, your muscle, your fascia, your tendons. Every piece of you is basically made better by estrogen. And I'm not saying everybody has to go on hormone replacement therapy, but I want you to know that you're a changing being, you're a cyclical being, and as your hormones change, you are going to become a high maintenance being now, ladies. Your joints become stiff, so I need you to do joint mobility to protect your joints and keep them mobile and supple. Your muscles aren't going to build as well because as you lose estrogen, which remember, testosterone builds muscle in men and women. Estrogen builds muscle in women. So as you're losing estrogen, you're losing muscle, and I need you to try harder to keep your muscle. I need you to try harder to keep your mobility. I'm going to need you to work on your rotator cuff. I'm going to need you to work on your plantar fascia. I'm going to need you to work on your Achilles tendon because your tendons and fascia also struggle without estrogen and they don't remodel as well. Also, estrogen helps you inhibit inflammation. So at the cellular level, you're different. And I'm sorry, but you're a high maintenance being now, but I've got you. But I just want you to know it was not your fault. You just changed, but now everything's a little more difficult, but we can do this. But we should have known that estrogen mattered so much because aromatase inhibitors showed us, like real life.